for the undergraduate research award and project. Basically what it is if you're a junior and you're interested in doing research, you can pair up with a faculty mentor, write up a proposal, develop a research project, and if it's approved, there is a financial incentive involved. Plus you get credit, and it looks very good on your resume and on your grad school application. So, if you are at all interested, I have flyers up here in the front. Please feel free to take one, and or contact me individually, and I can talk to you about the process. If you are on the SPA listserv, the student listserv, most of you probably got a, when you first open up, you probably had a message about this, and so there's more information there. But if you have questions or if you're interested, please let me know. Feel free to take one of the flyers. Okay? All right. So, we left off Tuesday with mention of Erickson's psychosocial stages of development. I'm not going to belabor that. I would like for you to take a look at those and realize that at different stages in a person's life, there are different life achievements that a person typically will navigate through. The reason that we will talk about those is that depending on the person's age and their age of onset when they experience hearing loss, it may shape or influence how they cope with, respond, react to it. For example, a child who is congenitally deaf or hearing impaired is going to, as he or she navigates through those different stages, going to experience life differently than an individual who became deaf or hard of hearing in their middle age years versus someone who was deafened or becomes hard of hearing late in life. And at each stage, there could be an impact. Think about, if you're in your middle years, someone like my age, and suddenly you are deaf or hard of hearing, you're gonna really react to that. It could dramatically impact hearing capability. It could impact your view of yourself and your role. It may make you feel old before your time. There's all of these different things it's going to influence. So I just want you to kind of be aware of those. What are the main tasks psychologically and socially that a person's going to navigate through at different ages, and know that you superimpose hearing impairment on that and it can influence what happens, okay? Don't belabor it, just have a general understanding. We're going to talk a little bit about the rehabilitation process, and one of the things that I mentioned is that often our rehab begins with the hearing aid fitting, but it certainly doesn't end there, or it shouldn't end there. Particularly if we are adopting which approach, a bottom-up or a top-down? Which of those approaches are we going to feel that hearing aids are an integral part of? Bottom-up, because the overall focus in a bottom-up approach is increasing the person's access to auditory information. Okay? That's the primary goal. But there's a problem, particularly with adults. It's not so much with children, but with adults. Hearing aids are not real popular. On average, a person, an adult, will wait 7 years from the time of diagnosis of hearing loss until he or she comes to terms with and decides to pursue amplification. 7 years. Now, let me ask you, if we identify a child with hearing loss at 6 months of age, and we wait to provide amplification for 7 years, what do you think might happen? We agree they're probably going to miss out on a lot. They're going to have problems with learning language. They're going to have problems with social skills and learning how to interact with people. They're going to suffer educationally and academically. Guess what? People who wait 7 years between the identification of hearing loss and the decision to treat it also suffer consequences. And we need to do a better job of educating people about that. On top of everything else, not everyone makes the choice to pursue amplification. Only 20% of the people who can benefit from hearing aids are currently using them. That's based on market track data. There is a comprehensive study that is updated every year called the Market Track Survey that looks at behaviors and related to hearing aid use. And the number has been pretty flat over time. Only about 20% of people who can benefit from the use of hearing aids actually use them. Why? Because studies show that there's a stigma attached. People perceive that they're going to be viewed as incompetent or old, and there's negative stereotypes. And you would think in this day and age that that's not true, but historical studies show that that's the truth, that people, they saw the same picture of the same person, and in one they obviously had hearing aids and one they did not. The perceptions were consistently more negative to the in response to the person with hearing aids than without, even though it was the exact same person. Just so the assumption was, oh well, obviously we're much more informed and sophisticated and open-minded in the 21st century than we were in the 1950s and 60s. Guess what? We're not, because we got the same results when those studies were replicated more recently. And so we have to do a better job of informing people of a very important statistic that we already talked about. What proportion of people with hearing loss are younger than retirement age? In other words, they're not old. 2/3. 2/3 of people with hearing loss are younger than retirement age. So we have to do everything that we can to break that myth or to debunk that stereotype that hearing aids and hearing loss are a sign of old age. They're not. And I guarantee you that's going to change with your generation, even if we do nothing, because statistically speaking, there's a much higher percentage of folks in your age bracket who now have measurable hearing loss than there ever has been in that age cohort on the face of the planet. The 12 to 24-year-old age group has a higher percentage of hearing loss right now than it has at any point in its previous history. And it's because of noise. Okay? So that can have a devastating impact on the person's rehab capabilities. What's going to happen if they wait 7 years or longer before we start trying to improve their access to auditory information? What's the ramification of that? You ever heard the expression use it or lose it? What does that mean? Why do athletes go to spring training or to off-season training camps? What's the purpose? Right. Condition, get into shape, hone their skills. Well, if you have a hearing loss, you have a sensory impairment, okay? You have an inability to have access to auditory information. What happens if you're sick or someone's sick or injured and for a prolonged period of time they're bedbound or have very limited activity level? Are they going to be able to? Yeah, their muscles get weak, they start to atrophy, they're not strong. Why? From lack of use. Well, guess what? If you have hearing loss, there's lack of stimulation to the auditory centers of your brain. What can result from that? You know, raise your hand.
About strength and
Yeah, they're gonna have difficulty with a lot of communication breakdowns. They're going to have problems with discriminating speech sounds. They're going to have difficulty with selective listening, selective attention, because their brains they live in a relatively quiet world until they've got the volume jacked up on their TV or their radio or whatever. They're missing out on a lot of information. And as a result, that use it or lose it phenomenon sinks in, and suddenly we get them hearing aids and they have access to all this sound, but guess what? Their brain doesn't have a stinking clue as to what to do with it. Because if you have ever witnessed a person, first time user of hearing aids, getting their hearing aid fitting, what do they say? Oh, this doesn't sound right. Oh, this is odd. What's that noise? Oh, that would be the heating vent. Oh, yes, paper rustling actually does make a sound. I had a lady call me. We had just done hearing aid fitting. And she was very, very content in the office, in the fitting room. She was amazed at things that she was hearing that she had forgotten or that she just wasn't even aware of. About a half an hour after she left, my phone rang, and the secretary said that this lady was on the phone, and she's all upset because her hearing aids are not working. I pick up the phone and, hey, so what's going on? And she said, my hearing aids aren't working. I said, well, can you hear me? She goes, yeah, I can hear you, but they're making this horrible sound. And it's only when I'm in my kitchen. And I said, okay, well, what's the sound? She goes, they're making this horrific clicking sound. All of a sudden I hear a dog barking in the background. And I said, what kind of flooring do you have in your kitchen? I have terracotta tile. I said, have you trimmed your dog's toenails recently? There was silence. And she realized she was hearing the click, click, click of her dog's toenails on the terracotta tile floor, and she thought it was her hearing aids. So, but the point being, the brain doesn't know what to do with what it hasn't had to deal with. So, the longer that people wait, the more difficulty that they're going to have. There's going to be a transition period where they have to get adjusted to hearing. And not just to hearing, but then to also be listening and processing. How long does that take? Studies show on average about 130, 140 days, 3 months, give or take. And how do we know this? Well, we've done some studies. they've actually done some brain mapping studies. Started off in primates where they would, they did brain imaging of primates engaged in certain activities using their hands. Then they sutured together two of their fingers. And they continued to monitor their brain mapping and periodically, and at about the 3-month stage, their brain map was totally different when engaged in those same activities, and they had modified their methodology for completing those tasks. So then they unsutured and monitored again, and guess what? About 3 months later, their brain map looked almost identical to what it looked like at the very beginning. So they started looking at brain mapping with other types of tasks and activities, one of which was looking at someone pre-hearing aid and post-hearing aid. And guess what? About that same amount of time was needed, and suddenly the brain map, particularly for the auditory comprehension, auditory association centers of the brain, looked different. But it took that length of time. Now there's some implications for that, because guess what the FDA says that patients are entitled to in terms of a trial period for their hearing aids? 30 days. Okay? So here we have a situation where the FDA says that we have to give them at least, doesn't cap it at that, it says we have to give them at least 30 days, which I can guarantee if you buy your hearing aids from a hearing aid store, that's what you're going to get, is 30 days. And yet we know that it's going to take at least 3 months, on average, for you to get adjusted to that new sound information. So there's some problems. Luckily, we deal with manufacturers that tend to be very generous with us, and as long as we get stuff back within about 3 months, they're going to be willing to accept it.
Does the longer you neglect it make it, like, does that increase the time that it takes for you to get used to it?
And so that 3 to 4 month time period is really for people who have gone for an extended period of time. So these 7-year and longer people. Folks who get amplification fairly quickly, first of all, they're going to have a better recollection of what normal is. Because that's what happens, is over time, people slowly accommodate to the loss. People start talking louder, people repeat more, they turn up the volume, they do things so that they don't even realize their hearing's getting worse or that they're accommodating for it. But the earlier that we get it, the more accurate their perception of normal is, and the more quickly they tend to go through that process. Everyone's different, though, because you can have a patient who, sort of like if you get new glasses or you get new contact lenses, sometimes you adjust to it very, very quickly, and other times it's like, ooh, but yeah, you have to really take your time to have that happen. So this is a problem, this reluctance, and so we really have to work to change that stereotype. And it's been interesting to see over the last 5 years or so, most of the marketing materials from the hearing aid companies have gone from showing old people, except unless it was something that was specifically targeted to pediatrics, to mostly people that look like my age, maybe a little bit younger, maybe a little bit older, and showing them involved in really active activities like Unitron, which is a manufacturer that I really like. They have a picture of this man and this woman. They've got on leather pants, a jacket, and they're sitting on a Harley. Then they've got another one where it's this woman who, she's certainly a little bit older. She's a little bit older than I am, probably into her 50s, but not geriatric by any stretch of the imagination. And she looks like, truly like a fashion model. And I forget what it is that she's even doing, but she's engaged in, I think she's on a sailboat or something. Yeah, I think it is because it's also, they were advertising their new nano coating that's water resistant. But we've seen this dramatic shift in the marketing because they really are trying to break down that barrier that hearing aids make you incompetent, feeble, and are a sign of old age. And because what's happening, I was born in the last month of the last year of the baby boom, but I can tell you I have virtually nothing in common with a lot of the baby boomers who are now, the oldest ones are like 67 years old. But even with them, folks that are that age are a lot more active, in a lot better health than when my grandparents were that age, or their parents were that age. So the hearing aid industry has to adjust to that. We as professionals have to adjust to that and do our part. So, but just know that you're going to meet a lot of resistance. And they may come in to see us, see you, and want you to fix their communication breakdowns, but they may not be willing to take all the necessary steps to make that happen. So you may be forced into a top-down approach, even if you tend to favor a bottom-up, because if they're not going to get amplification, and they need it, there's an entirely different approach you're going to have to take. Okay? Part of that rehabilitation process, regardless of which approach that you take, a bottom-up or a top-down, is going to involve counseling. And when I say counseling, I don't mean professional counseling like you would get from a psychologist, a psychiatrist, a mental health professional, where they focus on past experiences and behaviors, and they're looking for reasons for maladjustment. And they want to restructure the person's behavior and personality. We're talking about what would be considered non-professional counseling. That's something that's conducted by other professionals. It's discipline specific. And we're focusing on the here and now. We don't care about the past. We're dealing with the here and now. And we don't have to look for etiologies. We know why they're having the problems that they're having. They couldn't hear. And so we have a very problem and solution focused approach that's centered on relevant behavior change regarding their communication and listening. Okay? So we're still going to be providing counseling to them, but it's a very different focus. We're not trying to manipulate their personality. We're trying to provide them with information and relevant nuts and bolts, things that they can do to improve their communication difficulties. Okay? Non-professional counseling takes two different paths. And typically, we're going to be providing some of both. The one path is informational. Sometimes you'll see this or hear this referred to as content counseling. And the other is personal adjustment counseling. Content counseling is done when we're simply trying to provide necessary information. This is how your hearing aid works. When your hearing aid makes this sound, that is what it means. This is what it means. When you're in a noisy situation, you want to try and position yourself thus and such in order to get the most benefit from your hearing aids. It's information. It's nuts and bolts. This is what you need to know. This is what you need to understand. okay? That's different than personal adjustment counseling. With that, you're really trying to listen between the lines. You're going to be providing support and education related to maybe the question that's the elephant in the room that they haven't directly asked. Okay, so that might be when a patient comes in and you say to them, okay, it's time to go over your results of your hearing test. And the patient says, well, there's no need. I know my hearing's fine. Well, let me ask you, do you have any situations where you feel like you're missing out on what's being said? Well, yeah, when I'm talking to my wife or my grandkids because they mumble. Well, what about when you're on the telephone? Well, I don't use the telephone. I let my wife answer the phone. Why? Well, because we have a really crappy connection and people don't talk clearly on the phone. You see where I'm going with this. The person's obviously in denial. So how do I provide personal adjustment counseling without being confrontational to allow them to see, ooh. So I might say something like, well, it sounds to me like there's a lot of subtle hints that maybe you are having some difficulty hearing. And I'm sensing that that's difficult for you to handle or to accept. Why do you think that might be? And then I'm leaving the door open, I'm asking this open-ended question, and then he might say, well, everyone I know that has hearing aids, they're sitting in a drawer, they hate how they sound. Or, my family already thinks that I'm, losing my faculties and they want to take away my car keys and this and that and the other thing. Oh, so you're afraid that by admitting to hearing loss that your family's going to feel like, this is just one more piece of evidence that you're no longer competent, and you're afraid that they're going to start taking away your independence. Yes, exactly. Well, then I have a whole new way to jump off. I can say, but you know what? If you get hearing aids, what your family is going to end up noticing is how much more competent you are. You're not going to be reclusive. You're not going to be, holding back at family gatherings and just watching. Or you're going to, when they ask you something or comment on something, you're going to actually hear what they said, and you're not going to respond inappropriately. Because I bet that there are a lot of times when they'll say something and you misunderstood them, and you respond inappropriately. Can you understand why they might think you're going a little soft? Because you're not answering what they're talking about. Oh, so do you see how we've turned this dynamic completely around from denial to, okay, maybe this is what I'm really afraid of. My behavior is actually feeding into that, and I need to change it. So do you see how that's really different? And yet it's still well within our scope. Have any of you taken Dr. Kelly's counseling class? Is it worth it? Yes, it is very well worth it. It's now a required class, so it didn't used to be. It's terrific, and you're going to learn a lot more about this in that class. But it is important that we address this issue now. So know that a good oral rehab program, a good oral rehabilitationist is going to be doing a lot of counseling. You guys have sat in on numerous fittings, follow-ups. What do we spend most of our time doing in those? Informational counseling, right? Content counseling. Because they're asking, they've got all these questions. I don't know how, I can't figure out how to work the remote. Or I'm having trouble getting the hearing aid to stay in my ear. Or, you know, it stopped working 2 days after I got it. And I was afraid that I had broken it. And so I waited 2 weeks before I came in. Don't make me strangle you. But anyway, so we're going to probably spend a lot more time, at least initially, on this informational counseling. Once we've gotten the rehab process started. Until we get them to that point, so usually more in the diagnostic process, my experience is we spend more time on the personal adjustment. Because once we can get them to the point where they can accept ownership of their hearing problem and their communication breakdown, then we're going to have a much better job or a much better time of having them actively participate. Okay? So, when we're dealing with informational counseling, that's all we're doing. We're addressing questions that require a simple answer, kind of a matter of fact. Some examples. How do I change my battery? What's that squealing sound when I'm putting my hearing aid in? So you're typically just going to give a very succinct, direct answer to a matter-of-fact type of question. Just one information. How bad is my hearing? Pretty bad. How often do I need to change battery? Pretty clear-cut, simple types of information exchange. Personal adjustment counseling, you're dealing with those unasked questions or questions that obviously have an emotional tone to them. What caused my child's hearing loss? What's the person really asking in a question like that? Did I do something to cause my child to have this hearing problem? These hearing aids make me look old. What's the person really saying? Possibly. I don't want to be treated differently. I don't want to stand out in the crowd. I'm afraid, I'm losing my independence. And this is just one more thing. Okay? So you have to really listen actively and recognize that sometimes there's more to the question than what appears on the surface. And you have to be ready, willing, and able to acknowledge that. So if a person says to me, I should have been more careful during my pregnancy, as I'm explaining, I'm going to say, what I'm hearing is that you think you're in some way responsible for your child's hearing loss. So it gives them a chance to be heard, to let the floodgates open if necessary, but it also shows them that I realize there's something more going on here, and then we can address it. Because then I can, and mom or dad says, yeah, I can say, well, your child was born with a genetic mutation has nothing to do with anything that you did or did not do during pregnancy. There are so many things that can cause hearing loss that it's really amazing when a child is born and they can hear. So, you need to realize this is not your fault. You see that sense of relief, that look of relief on their face. So, content or informational counseling, it's matter of fact. Question, simple answer. Personal adjustment counseling, it's emotional. There's more than meets the eye. There's stuff under the surface. Okay? And it's important that we recognize what type of counseling is needed, because if we don't, we're going to have a communication mismatch. Communication match is when the person responds to and appropriately answers the patient's question. The mismatch is when we don't. When we don't answer the real question. So, patient says, "How bad is my hearing, doc?" And the audiologist says, we talk about hearing loss in terms of severity. How much of an impact is it having on your communication? Your loss is considered moderate. I bet you struggle in noisy situations, or if someone's talking while they're walking away from you, or not looking at you. Yeah, well, that's why. We have a communication match or mismatch there. Match, pretty much. The person simply wants to know, how bad is my hearing? You're telling them, and giving them an example to back up what it is that you say. What about this? The audiologist says, what problems are you noticing with your hearing? I don't have a hearing problem. People just want it. So the audiologist says, well, if you look at me, whip out their audiogram, who here has seen me do more than one or two hearing tests? How often did I whip out the audiogram and explain the information?
Like at the very beginning?
At all. Right. How long, who here of you thinks that you could really sit down, interpret, and explain an audiogram to a patient in 3 minutes or less, and that they're going to understand it? Because some of you probably are still struggling with understanding it. Why should we expect the patient to? So, my rule number 1 is, unless it's an engineer, someone who's really black and white and they need to see the living proof, I typically don't even get out their audiogram and show it to them. But, so the audiologist says, well, look at this audiogram. It clearly shows where your hearing falls below the normal range. Surely you can see that's causing you to have problems understanding what people are saying. Not everyone mumbles. You're just not able to make out what they're saying. We have a match or a mismatch here. Big time mismatch. So, how could we change that? What could we say? What could our inept audiologist say to that patient who says, I don't have a hearing loss, people just mumble?
You could ask them, like you said before, if they have troubles listening in noisy situations, and then if they say yes, then you can bring it back up.
Other ideas? You want them, in a situation like this, to take ownership of their lives. You want them to realize all the time. But it does often surprise me when I meet family members how often there is a seemingly large percentage of their family or significant others who do talk like this. You always get the soft-spoken spouse very hard of hearing spouse. Always. And it doesn't matter which one is male and which one is female, which one has the loss. You never get two loudmouths together. Because if you did, you'd never see them because they would not have any problems. They'd never come in. Okay. But yeah, you have to find a way to diffuse their defensiveness, because obviously there's some defensiveness there, and help them to take some ownership of their hearing loss. Okay? Alright, so here's an exchange. Parents just found out their child has a hearing loss. Says, I knew that hearing loss runs in my family. All my grandparents wore hearing aids for as long as I can remember. I've got cousins that had lots of ear infections and ear problems. I should have had genetic counseling before we decided to have children. The audiologist says, it's often difficult to know the exact cause of hearing loss. Match or mismatch? Who says match? Who says mismatch? There's a mismatch here. This is an emotionally laden, emotionally tinged comment from the parent. And we just provided a short, succinct piece of information. We have not acknowledged their concern. We've not addressed their unspoken commentary, which is, it's my fault that my kid has a hearing loss. So, how could we have been a better listener and improved our response? What might we say instead?
Well, it goes back to kind of what we said before about genetics. Like, you just encourage the parents that if it is genetic, there's nothing that, it's not your fault. Like, and it sounds like
That's the key, because the unspoken comment is, this is my fault. So yes, you hit it right on the head. That should be your first response is, I'm getting a sense that you feel this hearing loss is in some way your fault. You know what? If it is a genetic condition, you don't really have a whole lot of control over that. And there are so many things that can cause hearing loss. And a lot of times we really don't ever know for sure that it would be impossible for me to say something that you did or didn't do that caused this baby's hearing loss. Can you imagine how much differently the parent's going to feel after that than after the first one? I think they would feel like they were really heard and understood in the second exchange as opposed to that first one. Would you agree? I mean, if you were that parent, and I know for most of you, if not all of you, probably don't have kids, it would be hard to put yourself in that place, but believe me, when you have a child, you will truly lay your life on the line for that kid. You want what's best for them. And so if you think that you've done something that could have harmed that child, I can't imagine, probably the only worst feeling is if you had lost that child. You're going to need and want reassurance. All right, let's try another one. Parent says, should have gotten that booster vaccine when I was pregnant. If I had kept working, gotten so sick around all those kids and all those germs. The audiologist says, Mrs. Smith, there's nothing about today's results that suggests your hearing loss was caused by you getting sick while you were pregnant. There's so many things that can cause hearing loss. What makes you think that you caused your baby's hearing loss? Match or mismatch? Match. And this one is really hitting it and taking the bull by the horns because it gave them the reassuring information and says, and I know you're saying that because you think you did something that caused it. Why do you think that? And then she can say, well, all of my sisters quit work before they had their baby, and they're all telling me that I should have stopped working. And you'd be amazed at the stuff that you hear that people tell them. Anyway, bottom line, you need to know your role. We need to provide factual information that's specific to our discipline. We don't want to step outside of our scope of practice. It's not our place to do genetic counseling. It's not our place to provide psychotherapy. We may, in the process of dealing with the patient, maybe that mom that we just talked to, maybe she's got some deep-seated depression and anxiety surrounding the fact that she really, truly believes she's done something that caused that baby's hearing loss. Maybe that's when we, provide her with a referral to a mental health professional. I'm not going to tell you that your patients are never going to have problems that are beyond your scope. A lot of them are. And you need to be comfortable with making those referrals. So know that your role is to provide discipline-specific, factual information. You want to provide support and encouragement. You're a coach. You're a cheerleader. You're not a psychotherapist. You want to lay out their options, make sure that they realize that they have options. Part of our code of ethics says that we need to be truthful and honest, that we need to treat our patients with dignity and respect, and that we need to make sure to respect their autonomy. Well, we can't respect their autonomy if we don't provide them with their options so that they can be the ones that control their healthcare decisions. And we can assist them with making their decisions, but we cannot make it for them. What's something that we might do to help them make a decision about, let's say, they're trying to decide whether or not we've recommended 2 hearing aids for them because they have hearing loss in both ears. And they're trying to decide whether or not to get the 2 hearing aids or just 1. What can we do to help them make that determination?
You'd say, like, most people in your situation do this or that.
Good.
You can provide them with pros and cons to both situations.
That's usually the best approach. Help them, sometimes it's called a decision matrix, where they look at the cost and benefit or the pros and cons. And in a situation like this, I think we need to go beyond pros and cons. We need to go to the cost and the benefits. Okay? I'll give you an example. So, one hearing aid, 2 hearing aids. All right? So, lower cost, higher cost. There's one. Ooh, this is new chalk. Okay? Less help and noise. Help and noise. then we might ask a question. What's your lifestyle like? Oh, well, I work in a restaurant. You need help and noise. Okay? That's the one they're going to want to choose, one that costs less. But here, we need help and noise. Two's going to help with that. What's another advantage of 2 versus 1? Okay? 1, you're going to have a very difficult time telling where sounds are coming from. With 2, you're going to be much better able to. Have kids? Have pets? You ever have trouble figuring out where they are? What it is that they're saying? Yeah. Okay, well, you need to be able to tell. So you see what I'm doing? You kind of go through and you take that pros and cons list and then you examine their lifestyle with them. And at the end, they're making the decision, and they're either making right decision based on what's really most appropriate for them, or they're making an informed choice to not do what's necessarily best. In a situation like that, say we continued on, and the only advantage to the one is that it's going to cost them less money, and they opt to do that, you know what I say to them? You have 2 choices. You can either go to someone else who will sell you that one hearing aid, and then you are their problem. Or, if you choose to stay here, you are not allowed to make an appointment and come back and complain to me that your hearing aid is not helping you in noisy situations, that you are having a hard time telling where sounds are coming from, that you are having a hard time following conversation when more than one person's talking, because guess what? One hearing aid isn't going to help you with that. So, as long as we have an understanding that any of these problems that using a single hearing aid is going to cause, you're not allowed to come back and complain to me about, I'll be happy to sell you one. But you need 2, and if you're not willing to those stipulations, then I'd love to give you a referral to the local hearing aid store where they will be more than happy to sell you one hearing aid. And then they come back 2 weeks later and say, well, I went to this hearing aid store, this hearing aid store, and this hearing aid store, and they would only sell me 2 hearing aids, and they were a lot more expensive than what you talked about. See, it happened time and again. But again, you assist them, but they still have to make the choice. Make sense? Because if they're only doing it because you're one more person that badgered them into it, not going to be successful. Okay? So, that directional balance sheet or that decision-making matrix, you can put your pros and cons and the 2 courses of action. I like to do it this way, but you can do it so that you've seen like the Myers-Briggs where it has the 4 squares, and so you put your pros and cons and your 2 courses of action, and you map it out. I think this is just okay. They make the decision. Here's another. Okay. we're trying to decide, are we going to pursue an oral verbal communication mode for the child, or are we going to use manual communication? Okay? Well, pros are they can communicate with the rest of the family. It's more normal. There's less stigma. More convenient for family and friends. Drawback is the kid's going to have more difficulty because he has hearing loss. Their speech may sound a little bit different, and they may need cochlear implant surgery if we cannot get good oral communication just using their hearing aids. Pros for manual, they can navigate in the deaf world. They're not going to rely on hearing aids or technology. Downside is less accepted in the hearing world. Everyone that they interact with is going to need to learn how to sign, or they're not going to be able to communicate. And since most people don't sign, they're going to have a limit, and especially if you're dealing with the hearing family with it suddenly having a deaf child, you know, they're going to have many situations where they're not going to be able to communicate. Okay, so then, as a parent, I'm looking at, I got twice as many positives and the same amount of negatives. Maybe I'll go this route. It would be different, though, if we had deaf parents and a deaf child. You see how that decision-making matrix would be completely different? They can navigate, they don't rely on technology. Everyone that they interact with already knows how to sign. So since most of the people that they sign, they're going to have a ready pool of people. Suddenly we've got all positives. The only drawback we would have is that, it would be difficult to navigate in the hearing world. Well, chances are they have deaf parents, they're part of the deaf community. Don't really give a rip what the hearing world thinks. So, again, it's going to be very, very situation or case specific. You need to look at that big picture, and it would be best that you let them actually be the one making this matrix, and you just kind of helping them see their way through and ask questions, so that, well, if the rest of the family can hear, how well are they going to be able to communicate with the rest of the family if they're verbal? Oh, well, they won't have any problem. Okay, so they can communicate with it. So see, you ask them the leading question, get them to verbalize the pros and the cons. Because then it's not you feeding them a list. Does that make sense? So you don't want to take away their autonomy. Okay. Families can't live with them, can't shoot them. They can be a boon, or they can be the Achilles heel of success. A lot of times, they're enablers, particularly when you get the elderly couple. One spouse is the ears, probably the eyes, and the chauffeur as well. And serves as the interpreter. They allow isolation to take place, to not be out there and engaging. Go ahead and tolerate the TV being turned up. It's the worst case scenario. Best case scenario is when you get them in there and they're bickering because one is holding firm that there's a problem and you need to take care of it, and the other one's in complete and utter denial. Guess who's going to win? Especially if they come to see me, because I'm going to call them out every time. But the family can also be very supportive. They can be an extender of everything that we're working on. So I don't want to give you the impression that it's all negative. It can be very positive. but we're going to have to motivate them to stop enabling. You know, the definition of insanity is doing the same thing over and over and expecting a different outcome. We have to help our families and significant others see that. We can't bail them out. We have to stop the family from bailing them out. We need to be truthful with them. I can't enjoy a movie anymore because you're constantly asking me what they say. Well, I don't know. I just missed it because you were asking me what they said. You know, so you really want to point out to them in a loving, caring way that they need to stop the insanity. Okay? And they're going to have to be hard-nosed, type of tough love. All right? This is when we're dealing with adults. We need to be very careful in our counseling and interactions when we're dealing with a diverse cultural society. There are different norms, different roles that come into play depending on the person's background. Why do we care about this? Well, by 2050, that's easily in your lifetime, more than half of the population ain't going to look like anything. They're going to look like this kid right here, my little Guatemalan boy. Because people look at him and they're like, is he mixed? Is he Asian? Is he Hispanic? Because he has just that wonderful ethnic look. Well, his mother was Mayan, his father was French-Canadian. Okay? That's why he has curly hair, tan skin, but at the age of 11 is already this tall, which is full grown for most Mayans. I mean, he's ginormous. Most Guatemalan dads are shorter than me. So he's multicultural. And so we need to get used to that and recognize that. And depending on the person's background, we need to adjust how we interact. For example, in some cultures, it would be inappropriate for us as professionals to direct our comments or explanations to the female. For dealing with parents, for example. In other cultures or in other ethnic groups, we would direct our comments to the oldest female. Because some cultures, some ethnic groups are very patriarchal, others are very matriarchal. Okay? For interactions with some groups, touching, close personal space, making small talk are expected and normal. And in other cultures, you've committed a mortal sin by doing any one or combination of those. Okay? So you need to be aware of that because we are living in a society where the demographic makeup is rapidly changing. It was just 2 or 3 years ago, the Hispanic population surpassed the African American population in terms of proportion of the U.S. population. was interesting because that same year was the first year I ever saw a commercial that featured a Hispanic family. It was from, I think, Royal Caribbean Cruises. And wow, that looks like my little boy. Because up until then, you really didn't see stuff like that on TV. If you saw a Hispanic person on TV, they were usually a criminal being chased down by the guys on Law and Order. That's what you saw. You didn't see mom, dad, and the kids enjoying a cruise in the Caribbean. I mean, it just didn't happen. But things are changing. So just be aware of that. All right? It could be racial, it could be ethnic, it could be religious. Who here has ever dealt with or been in a communication interaction with someone from Middle Eastern background? Were they Muslim or Jewish or Christian faith? I bet you know, because those are the three main possibilities, and they are extremely distinct. Okay? And along with that are very clear-cut, strict cultural norms. And guess what? They're all different, depending on which group the person falls into. So I have included, for your reference, a little bit later, some cultural competencies for different groups. Anglo-Europeans, folks like me, African-American, Asian-American, Latinos, Middle Eastern, and Native American, believe it or not. They have cultural norms that are different. I'm not going to read over all of these. I want you to have that information. I want you to be able to take a look at it. The reason that this is important is because when we look at the prevalence of hearing loss and the incidence of hearing loss by race and ethnicity, the numbers are staggering. 14% of non-Hispanic white adults have hearing loss. 6% of non-Hispanic black adults have hearing loss. 14% of Hispanic adults have hearing loss. So, if we have an adult who's white or Hispanic, we've got more than twice the likelihood that they have hearing loss than if the individual is African American. Okay? 9% of all children who are deaf or hard of hearing come from homes where some language other than English is spoken. That's a huge number. That may not sound like a lot, that's a huge number. You're going to encounter, whether you're an audiologist or a speech pathologist, you are going to encounter children who have hearing impairment who come from a household where something other than English is spoken. Okay?
So, when you do have that situation, like they have one household that speaks Spanish or something, and they are deaf, and you're trying to like facilitate sign language or something, would you use their native language to teach them, or try to teach them like American language?
What would you do? Do you know Spanish sign language? And then the question is, which Spanish? Mexican, Colombian, Venezuelan, Guatemalan, Castilian? Guess what? Do you know that people who communicate using American Sign Language are virtually unable to communicate with people who use British Sign Language because they are that totally different? It's not like when you go to Niagara Falls And the novelty shop has a sign on the window that says, English spoken here, American understood. You know, it's not, you know, it's not that close. It's not like us listening to our cousins in Australia or our siblings in the South. So, very good question, Taylor, and I don't have a good answer other than if it were me, I can only work with them with what I know. But the point being is, and what I want you to get from this is, we're going to be encountering kids and adults from diverse backgrounds that have hearing loss, and we need to get used to that. 50% of children with hearing loss in our elementary schools come from a linguistic minority background, and 30% of them are Hispanic, Spanish speakers. And guess what? Later this year, when our Commonwealth of Puerto Rico becomes the 51st star on the flag, those numbers are going to go up even higher because we're going to have an entire state whose population speaks a language other than English, and those numbers are going to skyrocket. So you want to guarantee yourself a job, learn Spanish, get your master's degree, and do the same thing.